In this presentation, we'll explore medical thermography, often called digital infrared thermal imaging or DITI. It's a passive, non-contact method that visualizes temperature differences on the body surface. Unlike X-rays or MRI, thermography detects emitted infrared radiation from the skin to infer underlying physiological changes. It has gained interest for early detection of circulatory or inflammatory processes, particularly in oncology and vascular medicine. We'll review its principles, applications, advantages, and challenges in modern clinical use. The aim is to understand where thermography stands in today's diagnostic landscape and how it complements other imaging modalities. Thermography works by detecting infrared radiation naturally emitted from any object with a temperature above absolute zero. Medical systems operate in the long-wave infrared range, roughly to 8 to 14 micrometers. The detectors convert this radiation into electrical signals, which are processed to form an image showing temperature distribution. The result is a thermal map, where each color corresponds to a temperature level. Because it's passive and radiation-free, clinicians can perform repeat measurements without harm to the patient. Accuracy depends heavily on camera sensitivity, calibration, and environmental stability, which is why controlled imaging rooms are essential. A thermography setup includes an infrared camera, a computer, and analysis software. Before imaging, the patient rests in a stable temperature environment to eliminate transient thermal artifacts. Images are captured at fixed angles, typically anterior, posterior, and lateral, depending on the target area. The software identifies regions of interest, calculates temperature gradients, and compares left-right symmetry, often critical in detecting abnormal vascularization. Automated algorithms can mark hot or cold zones, providing clinicians with quantitative temperature maps. High quality calibration and environmental control remain vital for diagnostic reliability. Thermography's clinical reach extends across many specialties. In oncology, it helps identify abnormal heat patterns in the breast, reflecting increased vascularity and metabolic activity. In vascular medicine, it's valuable for assessing blood flow in extremities, such as diabetic feet, where early temperature changes can precede ulceration. Neurological uses include detective nerve entrapment, syndromes like carpal tunnel. Surgeons use it intraoperatively to assess flap viability and perfusion. Although not diagnostic in isolation, thermography provides early physiological clues that guide further imaging or treatment decisions. Thermography's key advantages are safety, non-invasiveness, and the ability to detect physiological changes early, before anatomical damage appears. It's particularly helpful for longitudinal monitoring since repeated imaging poses no risk. However, results can vary with environmental conditions, camera calibration, and patient preparation. Factors like sweat, clothing pressure, or ambient airflow may distort readings. Standardized imaging protocols are vital, yet historically inconsistent, which is one reason thermography has seen uneven clinical adoption. Recent advances in detector accuracy and AI analysis aim to reduce these sources of variability. Interpreting thermograms require understanding normal physiological symmetry and expected temperature ranges. Healthy individuals typically show bilateral symmetry, so deviations greater than 0.3 to 0.5 Celsius can be significant. Hot areas may indicate inflammation, infection, or neoplastic growth, while cooler zones can point to vascular insufficiency or neuropathy. Software assists by mapping isotherms, equal temperature contours, to visual gradients more clearly. Comparing serial images over time can help clinicians monitor healing, treatment effects, or disease progression. Thermography is entering a new era, driven by technology. Modern sensors capture finer temperature differences, and AI systems can automate anomaly detection. Research focuses on integrating thermography with other modalities like ultrasound or MRI, forming hybrid datasets that combine structural and functional insights. Machine learning models are being trained to predict early vascular or metabolic disturbances from subtle heat signatures. In the future, portable or wearable thermosensors may enable continuous physiological monitoring, bringing thermography closer to point-of-care applications. In summary, thermography visualizes the body's heat patterns to reveal physiological processes that other imaging may overlook. It's safe, quick, and becoming more accurate with technological progress. Its main strength lies in complementing, not replacing, structural imaging such as MRI or ultrasound. Ongoing research into protocol standardization and AI-enhanced analysis continues to strengthen its clinical credibility. Ultimately, thermography bridges physiology and technology, providing a unique perspective on health monitoring and early disease detection.